Hi guys. My name is Mariah Salveson and I am doing my presentation on single photon emission computed tomography, also known as SPECT scan. So what is a SPECT scan? It is a nuclear imaging test that shows how blood flows from the tissues and organs just around the brain. They combine the use of computed tomography and radioactive tracers, and these images are collected by a gamma camera. They can be used to diagnose seizures, strokes, stress fractures, infections, tumors in the spine, and just any other implications of the brain. So, how it works is before, you're not supposed to have caffeine, you're not supposed to eat 6 hours prior. You can have water, however. They place the radioactive tracer into like your bloodstream just with a needle. They inject it into you. You rest for about 10 to 20 minutes until the tracer reaches your brain, and then they can begin the scan. So during the scan, each patient will lie down completely still on the bed while the scanner rotates around the head collecting the images. Afterwards, the patient can return to normal activities. They may leave. They, however, should drink tons of fluids to just kind of flush out all that radioactive tracer. And then they should discuss with their doctor about setting up another appointment just to kind of go over those results. So, what does a SPECT scan show? It just shows like the blood flow throughout the veins and arteries. They can detect reduced blood flow to injured areas. So, if you look in this image here, all the highlighted areas are like just kind of where the blood is flowing, and like the darker areas, that's just like where the blood is not, there's not so much blood flow through there. So the advantages of using a SPECT scan is that it's cheaper than a PET scan. There's more availability across all regions, and it has been extensively validated and is better sensitivity compared to other methods of assessment. However, the disadvantages is that there are exposure to radiation. It's not inclusive to all individuals. Women that are pregnant nursing cannot receive the SPECT scan, and some people may even have an allergic reaction to the tracer. So how is this used in speech pathology? A lot of SLPs use SPECT scan results to determine like the speech dominant hemisphere. They can also detect tumors and injuries of the brain that may negatively impact speech, and they can determine TBI and stroke necessary for speech treatment, just kind of which areas of the brain, whether it's Wernicke's or Broca, that blood flow, being able to see that will just help in speech pathology tons. These are my references and resources that I used, and thank you guys for coming and listening to me talk. Hope you guys have a great day.